Hello, Doc. Dr. James R Fedich here, drjamesfedich.com. You probably remember me from my best-selling book, Secrets of a $1 Million Practice, or from our top-rated podcast, Dr. J's Path to Success. Either way, I'm here to talk to you about report of findings. So report of findings is one of the key visits in a chiropractic clinic. There's only certain different visits, day 1, day 2, reevaluation, re-report, regular office visit. There's only a couple different interactions that you're going to have over and over with patients. And one real important one is a day 1 or first visit, and the report of findings that we're going to talk about today. So teaching a proper day 1 and day 2, is an hour each day at least. But I want to go over some of the key points that you can do on your own to improve your day 2 or report of findings. Probably your most important thing. So one thing we say, it's great to see you today. We're here to discuss your exam results. We're not going to say, that's just a normal thing that patients are used to hear. So here to discuss your exam results. People always ask me the same 3 questions. What's wrong with me? How long do you fix it? And what's it going to cost me? And those are the major things we want to cover today. So you get those objections out of the way. The people are all nervous. They're sitting there. How much is it going to cost? Are they going to fix me? Do I have cancer? Especially if you're not treating on the first visit, which you shouldn't be doing a lot of. For most offices, again, way too much. Then we're going to explain their test results. So depends on what you're doing in the office. We don't x-ray in my clinic. We do a lot of myovision EMGs. If you're doing an x-ray, you're going to go over the x-ray or MRI next, or if they do have MRIs, you're going to go over the x-ray or the myovision next. Then we're going to go over the vertebrae model and just kind of show them the subluxation. So between the vertebrae, exits to the nerves, the spine comes out of place by the trauma. These muscles tighten up. The nerves get pinched in between. We call it subluxation. What each adjustment does is take more and more pressure off the nerves. Just like braces on teeth, we're going to slowly align the spine and take the pressure off there. So I like to use a lot of dental analogy. Brace on teeth is a really, really good one. The retainer for correction, always really good analogies. I'm a big fan of analogies. Pinch nerve, I'll say kink in the garden hose, and it's really a lot of good analogy out there. We do a posture analysis in the clinic as well, so I'm a big fan of that. Posture Screen Mobile or Pro, something like that, Joe's program. We go over that posture scan. A lot of times it's going to explain to people, they have a horrible forward head carriage, so listen, we get rid of your headaches in a couple visits, but you're going to have this old lady neck for the rest of your life, so we want to address that now. So we go over through posture, and then we kind of get into our structured presentation. So we got to get pressure off these nerves. Been there a long time. We need to correct this underlying cause of the problem. It's been developing for a long time. We take 4 or 5 or even 6 dozen treatments to fix this. Start with initial 12 visit, reperform or reevaluate you and see where you're at. If you're not much better, we can change what we're doing, or maybe we need to do something different. If you're a little bit better, we'll see that. And if you're improving as I expect, we'll be able to reduce your treatments at that point. And obviously there's more nuance than that. Then we do a consent form. Let's say sign the consent form for now. And then you want to explain the treatments after that. So your first 2 visits typically are going to be a lot longer than your regular visits, usually a lot longer. In our clinic, it's 30 minutes first visit, maybe 25 and 20 the second, and then it's 15 minutes after that. So we explain it to them. So for now on, don't worry, it's only be 15 minutes. You'll see these 3 times a week for the next 4 weeks to reassess you and go. And then give them a little tour of the office, and then we go over the insurance or money. Now, it depends on where your clinic's at. We have a larger facility with 5 providers, so we have a staff person go over the insurance. And I found that's better when you have multiple associates and multiple providers. It just gets all kind of crazy. If you have somebody good that you train on it, I like to have the staff do it. If it's you as your sole doc, you got 1 or 2 people working for you, do it yourself. And then we're going to give a quick tour of the office so they know what goes on from now on. So from now on, you're going to pay your copay on the way in. We're going to send you right to a treatment bag. You're going to get A, B, C, D, whatever it is that you're doing, your procedure, explain to them. You're going to go in, you're going to get your adjustment, you're going to do your therapies afterwards, and then you'll just leave because you're already pre-scheduled. And then you'll try to obviously schedule for the next couple weeks. So let's get your first 4 weeks treatment scheduled so you don't have to worry about it. You can get the time that works best for you. The doctor wants to see you 3 times a week. So I also have the staff kind of reiterating what the providers went over. The doctor wants to see you 3 times a week in the next 4 weeks. Let's go ahead and get you scheduled. Take care of the finances. You want to have a financial plan out. Take care of all those copays up in advance. So there's a lot of little nuances there, but it's just a quick video, give you some little things. There's a lot of little tips in there. You can really increase your report of findings just by following a couple of those little tips in there and really increase your practice. So there's a lot more information on our website, drjamesfedich.com. We have our ultimate new patient marketing machine and toolkit has this with it as well. So there's a lot more training on this, but just a quick overview for you, and hope this helps you grow your practice. Have a great day.